Imagine this, you're watching Women's World Cup final at home with your family. Jemima has just hit a 6 and your 6-year-old son, out of excitement, jumps off the couch, slips on the carpet and falls flat on the face. You check your child's mouth and you see there is blood and you find that the one front tooth is missing. You panic. Hi, I'm Dr. Uma, Consultant Pediatric Dentist, Manipal Hospital, and today I'm going to talk about common dental injuries in children. When toddlers, 2 to 3-year-old, they start learning to walk, they don't walk, they just run, they trip and fall. As a result of this, either they displace their front tooth or the front tooth gets knocked out. If the front tooth is displaced, we tend to reposition them and stabilize them. However, if the milk tooth is knocked out, we do not put it back in position because it may damage the underlying permanent tooth. However, the child still needs to be checked by a pediatric dentist to ensure there are no other injuries to the supporting tissue. School-going children tend to develop injuries to their permanent teeth as a result of playing in the school field or during sports. Now, the front tooth can again get displaced, which we stabilize, reposition and stabilize, or the front tooth may get chipped. If you can find the chipped fragment, we can reattach. But the most distressing is the front tooth getting knocked out completely. When this happens, time is of essence. This is because if the tooth remains outside the mouth for a long time, then the chances of it to heal are very slim. So what you should do? In this situation, as soon as the tooth is knocked out, please try to put it back in position and rush to the nearest dentist. If you cannot do so, please store the tooth in cold milk or child's saliva and rush to your nearest dentist because, as I said, time is of essence. So please remember, do not keep the tooth out dry because if it dries up in a tissue or in a napkin, then the chances of it to heal are very slim. Please remember, calm and quick actions can lead to good outcomes in case of dental injuries in children. Thank you.